Hi, I'm Daniel Paul. I'm here today with Catherine Hall, the Chief Executive of Alzheimer's New Zealand. We're talking about the Dementia Action Plan. This is another in our series of videos about the plan. Catherine, the plan talks about the need to reduce incidence, the number of people who are actually diagnosed with dementia. Given that we've got an ageing population, how are we actually going to achieve that?
Well, look, Daniel, dementia shares quite a few of the risk factors that other non-communicable diseases have. And those are lifestyle issues. So things like, obesity, smoking, high cholesterol, those kinds of things. So what we know from the international evidence is that with the right programs and interventions, it is possible to reduce the likelihood of developing dementia by focusing on those kinds of things. And the rule of thumb is what's good for our heart is good for our brain. And so that means that the things that we all know that we are good for us. So get regular exercise, eat a healthy, well-balanced diet. Make sure that we look after our heart, so don't smoke. If we've got high blood pressure or high cholesterol, make sure that that gets treated. But there's also some other things that we also know are helpful. Keeping our brains active by continuing to learn throughout our lives and keeping socially connected is something that we know helps reduce the likelihood of developing dementia. And another thing that we know from the research is that a hearing loss can increase the risk of developing dementia. So, if you can't hear, if you're having trouble hearing, it's a really good idea to have that assessed. And if you suggested to wear an aid, then do wear one. But the important thing about all of those kinds of things is that if we were able to really target those and have programs, then we could be reducing the population numbers of people with dementia by between 10 and 20%. That's huge.
That's what I was trying to get. Yeah.
That's huge for people who, for the people who might have developed dementia, but it's also huge for the health system and for the economy in terms of that impact. So it's absolutely worth doing. But to do that, we've got to have programs that target middle and older New Zealanders, as well as programs that target young people.
Thank you, Catherine. Thank you for watching. Please keep an eye out here for our next video, the next mini series about the Dementia Action Plan. Thanks, Catherine, for your time.